any restriction for right, they will take that sitting position. The standing position also, sometimes the standing position is, for example, if you can hear some of, if the age is more than 35 or 40 age, the doctor will suggest to take the treadmill ECG. Okay, you might hear about that, the treadmill ECG. So when it's the treadmill ECG, it's a standing, right? So, but whatever may be the ECG position, which position was captured. So again, it's EG ORR is original results of your ECG, and then the original results units, okay? And then character results of the standard results character version, okay? So there you can get that negative, positive, and then these are the kind of values, okay? So bradycardia, arterial flutter, whatever the maybe this medical terminology will comes under here, the character version of the standard results. Again, the numeric version of your standard results, whatever the numbers we will have, that comes to here, okay? So the EG, STR, ESU, as you know, the same concept, the original results whichever is captured in the site level, that will comes to the EG or ESU, corresponding units comes to this variable. So when it convert to the standardized, or the same we are mapping that your standard units, okay? Again the same EG start and EG reason, okay? So if it's not done, then the start should be populated, it's not done. If it's not done, then what is the reason why it's not captured for the ECG? That will comes to the EG reason variable. So the EG FXN, so the ECG external file path, okay? Sometimes what happens, as I said, this ECG also will comes from the vendor, okay? So the particular vendor, if there are any vendor, that comes from that we can put that, okay? So the EG name also vendor name, that particular path and the vendor name. And then EG lead, so the lead location of use to the measurements, okay? This is the EG lead, okay? So this is one of the medical terminology. So the which lead is this, okay? Like 6V6, EVR, 1, 2, 3, these are the some kind of leads. The EG method, okay? So what kind of method is this? Okay, it's a 12-lead standard method or whatever the thing. So with the medical terminology, what kind of method used for the ECG? And then EG BLFL, again it's a baseline flag. So you already know the definition of the baseline flag, latest non-missing value prior to the treatment. Okay, so the EG DRVFL is a derived flag, whichever the record is derived, that particular record will have the derived flag should be Y. Okay, so the EG eval, so the evaluator. So here one thing you need to understand that, okay, this is the one of the scenario you can get in the ECG domain only. Okay, so what is that you have to evaluator is the important thing. So evaluator is nothing but, okay, so based on the ECG report, the principal investigator will tell that what is his opinion on the ECG. Okay, so who evaluate the ECG, that might be the like investigator or adjudication committee or a vendor or the principal investigator, whatever the doctor who investigated this ECG, so comes here. Okay, so the basically here also we are going to create one test CD based on this. Okay, how we are going to create means, okay, so what we have seen so far this ECG, like there are a number of test CDs like, okay, QT-CD, QT, what we have seen here, the examples, okay. So the PR main, QT main, QT-CD, PR CD, these are the some test CDs, right? So the overall all test CD results, the doctor will investigate these results and then he will provide his opinion. So the overall the ECG, how it looks like, I mean, for example, if you can see, go to the doctor, there will be a ECG report, and if you can see the report, we cannot understand directly, but because there will be a graph and then some numbers. So how do we know this by seeing these numbers in the graph, that like heart function is good or not, and so the doctor will see that he will provide his opinion. Okay, so this is abnormal, normal, bradycardia, tachycardia, these are the some medical condition, he might say that. So that opinion also we can create one test series. Okay, so then the visit num, visit device, this is a regular variable for all finding domains. EGDTC is nothing but the data of ECG collection, and then EGDY is the corresponding study day Okay, so which we can calculate based on the RFST DTC. So EGTPT, again, it's a time point. Which of the time point is like it's a 5-minute post or the pre-dose, post-dose, 1 hour, 2 hour, whatever it may be. And then it's a EGTPT num. Each and every TPT num will have one numeric number like visit num. So this is the TPT num. So the elapsed time is nothing but based on your TPT, we can create a elapsed time point. It's a PT, and then for the post dose, and then minus PT for the pre-dose, and then corresponding values 15 minutes, 1 hour, 2 hours, 1 day, 1 week, 2 weeks. It depends on that based on the elapsed time. Okay. And then EGTPT ref. So EGTPT ref is again, this will be particular reference point, previous dose, previous meal, RFST DTC, any particular milestone, they will give the reference for this ECG. So that reference date will comes to here. Okay. So this is the ECG RFT DTC. So if you can see, is there any new variable which we can see? This is the one of the EG evaluator. It might be seen the other domains. Okay. So the rest all the variables you have seen the same, pretty much same. Okay, this is the EG num, EG, this two. So if you can see, the 95% of the all variables from your finding domains will be really same. This will change only the prefix of the domain. That's it. Is that clear? You have any questions?
Clear, sir.
Okay, great. So yeah, if you can see this, okay, these are the some of the example. Okay, these are the tests. Okay, HR mean, PR mean, QRC duration, and then QT mean, QTCB, QTCF. Okay, so RHY rate. These are the some tests. Okay, these are the particular test name and the which position is captured, the result, and then the units. Okay, if you can see, these are this. Okay, some character responses is captured. Yeah. So what I said, this is the test INTP. Interpretation. Okay, so these all are the test series. So what doctor will prescribe, what doctor will say that based on these results, he will confirm that whether is ECG normal or abnormal. So that is the interpretation. So one extra record we are going to create with the interpretation. Okay, so INTP is the test CD and then interpretation is the test. So the ECG is abnormal. Okay. So that's what we discussed. Okay. So who is EG eval? The principal investigator. Okay. So this is the ECG. Okay. Is that clear? You have any questions?
Clear, sir.
Okay. So now we'll discuss about the IE. So inclusion exclusion criteria. So can anyone tell what is inclusion exclusion criteria? This we already discussed. What is the inclusion criteria and exclusion criteria? What is the importance of in the clinical trial?
No, yes, sir. Yes, sir. All exclusion criteria should be no.
No, I mean if the subject, okay, so the one of the inclusion criteria should be the sum 18 to 60, but his age is 17. Still he need to say yes?
No, sir.
Then how? What is the importance of this inclusion exclusion criteria?
So based on that, the subjects are selected for the clinical trial.
Carefully, I think of the few people said like partially correct, or like 15 to some 20 to 30% answer is correct. Okay, So the inclusion exclusion criteria means each and every clinical trial, whenever they are going to conduct the clinical trial. So when they write the protocol, so in the protocol itself they will say that okay, the clear inclusion and exclusion criteria. So the inclusion exclusion criteria is nothing but the enrollment requirement. Okay, if the subject want to enroll in a study, the subject has to met all inclusion exclusion criteria. Okay, so the subject has to met all inclusion exclusion criteria. Subject met means, again it comes to the point wise, all inclusion criteria you should met, and then exclusion criteria you should not met. So the exclusion criteria if you met, then the subject could be excluded. So the overall this condition we can say that inclusion exclusion criteria met. It means if the one of the subject is all inclusion exclusion criteria met, means he is a screen passed. For example, one of the subject is not met the inclusion exclusion criteria, is a screen failure. So he met all inclusion exclusion means that doesn't mean that so he met all inclusion criteria and then he did not met any one of the exclusion criteria. So then we can call it as a enrolled subject. Okay, that is the inclusion exclusion criteria. Okay, so in any clinical trial this will be mentioned in the protocol. So okay, based on the requirement they will design. Okay, so for example, if you have the 10 inclusion criteria, subject should met all 10 inclusion. If you have the 10 exclusion criteria, subject either should not met one of the criteria. If he met one of the criteria, then subject will not enroll in the study. Okay, so that is inclusion exclusion criteria. So these inclusion and exclusion criteria related, trial related information will map to the TA, trial inclusion and exclusion criteria. The subject level information will map to the IE. Okay, so this comes under finding domain. So here we don't have the much variable, so but you can see. So these four variables you know already, sequence and all these things, and then the sponsor ID is the sponsor specific ID we can create. IE test ID is nothing but so here we can create the here INCL01, EXCL01, something like that we can create in the real time. Test ID INCL01, INCL02, INCL03. So the inclusion criteria in INCL. So the exclusion criteria EXCL01, EXCL02, EXCL03, something like that we are going to discuss about. Okay, so the IE test is what are the particular criteria. Okay, so the particular criteria, for example, IE inclusion criteria A should be 18 to 60. That is the one of the inclusion criteria. So that it is INCL01, that test name. What is the test? The age is between 18 to 60 is a test. Okay, so something like all the inclusion exclusion criteria will act as a IE test. The particular we can create as the individual inclusion exclusion criteria test series. Okay, so remember so this test, IE test, should not increase more than 200 characters. Okay, if it's a 200 characters, we can restrict the meaningful 200 characters, and then that will go to the entire test will be SDRG once we start doing the submission package. The next category and subcategory. So inclusion exclusion criteria is nothing but okay, this is the inclusion category and then exclusion category. So inclusion criteria is one of the category, exclusion criteria is one of the category. Subcategory is that okay, is it major or minor, something like that we can mention. So the IEOR is that okay, subject should meet the criteria, yes or no. This is the responses. Okay, so again the results is a character version, again yes or no, and then visit num, visit dy. So most of the cases this will come under screening visit only. Why? Because the screening visit only it is going to capture the inclusion exclusion criteria. So once this checked only, the subject should sign the informed consent. After they will check this screening criteria. If it's screen paused means this subject met all the inclusion exclusion criteria. So the IEDY is nothing but the collection of the particular inclusion exclusion criteria date. Okay, so then the IEDY is nothing but the study day. That's it. Here we don't have much variables. Okay, this is a simple regular identifiers as well as the some test SCD and then category visit num, date. Yeah, so someone raised their hand. Any question? Of the things, okay, the inclusion exclusion criteria test. Okay, so Here this is a particular read one of the criteria exclusion. So this acceptable mammogram from the local radiologist. So this is the one of the inclusion criteria. So the subject met this criteria or not, this IU or RES, okay, the corresponding dates, okay. So these are the some of the example for that, if you can see. Is that clear? Are you any questions? So if you can see all the finding domains looks like similar only. We already seen the LV domain. Yeah. So the microbiology specimen findings, so microbiology MB and MS domain, here also will same, the data comes from the microbiology specific findings. If you can see all the variables are same like what we have discussed, okay. So next what else, MS also will be really same. MI, okay, so microscopic findings. If you can now you can read the all SDTM IG, you know the basics, and then you can easily understand. So the morphology findings. Same naming convention for the variables. PCG, okay, plasma concentration, okay, pharmacokinetics, okay. So the pharmacokinetics domain again here also the same variable naming convention. So here the pharmacokinetic parameters will have the PK also. So again, I mean there are a number of tests and test results thing based on this, okay, questionnaires, okay. So the questionnaires also one of the finding domain. Here will have the data will be like based on the questionnaire related, okay. So like quality of life, there will be a number of questionnaires, okay. So the quality of life, Columbia ideal suicidal severity scale, there are a number of questionnaires, okay. So the each and every question they will have the set of questions, each and every question will have a test, okay. So that the question response will be the result. So that particular test we can create one test CD short form. So that's it. The again remaining the variables would be same, QS test CD, QS test category, subcategory, results, units, and then character version of the standard results, numeric version of the standard results, and then standard unit status, reason, baseline flag, derived flag, evaluator, visit num, visit dy, QS DTC dy, TPT num, elapsed time, RFT DTC, and all these things. The same. So evaluation intervals. These all are similar variables. Nothing will be new into the any other finding domains. So we have already seen all the domains. Okay. So this is the reproductive system findings. Okay. These RP domain. Oncology therapeutic area will have these three tumor related, okay? Tumor identification, tumor results, and then disease response. Okay, these are the three domains which we are going to create for only oncology domains. Okay, this will not create in the regular domains. Okay, so that we can see in one class. Okay, not only the variable naming convention would be really same for that what we have seen. So, but we have to know that some of the specific characteristics of the oncology domains that I have a slide deck with me, so I can take one of the class for the oncology three domains. Okay, no worries about that, but the variable naming convention will be really same what we have seen so far. What else what we can take? I mean the rest of the domains would be same as it is. Okay, if you go with all finding domains, and then I think we covered all classes. Or is there anything which we missed? I think events, interventions, findings, special purpose, we covered all right. Did we miss any for class? So this also seeing vital signs. Then that is going to capture. The EX is somewhat is a derived thing. Okay, so what was the total daily dose and all these things. So how it was going to be derived. Okay, that is the EX. Okay, so there are few differences also, but I have with me this one of the ECG and EX differences. I will take you one of the class for EC and EX differences. Okay, with the different real-time examples. Okay, so that would be one of the interview question that I can take it up. No worries about that. Okay. Hello, is that clear? FSTDTC, okay, it is a record qualifier. It's not a timing. Actually, when we see that, we thought that, okay, these are the variables, we have the whole the date variable. So everyone will thought that, okay, this is the timing qualifier, one timing variable. But actually it's not. When it comes to the demographics, these reference start date, RFSTDTC, NDTC, XSTDTC, XENDTC, it will qualify the record. For example, these are the particular, it's not a assessment related or something like that. This is the some particular reference. I mean, first dose of drug administration is the one of the particular important milestone. When it comes to the role, this will qualify entire record. Okay, so that's why if you can see these 5 variables, it will not consider as a date variables. Okay, date timing variable. But whenever it comes to the assessment dates, if you can say DMDTC, that would be the time variable. Yeah, if you can see DMDTC, this is holding the simple date. Even though here it's also holding the date, but it's not a particular date, it is a reference to the something. So that's why it qualifies the record, that's why it is the record qualifiers. Is that clear?
Yes, sir.
Yeah. Any other questions? Okay, so if no questions, okay, please go and read the complete SDTM IIG. So tomorrow we'll see that if there are any domains which is missing, like rel, reg, and then supplementary qualifiers. And then the day after tomorrow, we are going to start with the CRF. What is the CRF? What is the CRF annotation? Everything we can start. Okay. So very soon, means after 1-2 classes, we are going to move to the real-time work. So by that time, you should be thorough with this subject. Please read that each and every person, this SDTM IIG way, domains and the variables and the assumptions, and they come up with the question if you are unable to understand. This is very, very important. Okay. So if you know these variable naming convention, data, how it's going to capture, which domain is going to map which kind of data, which variable contains which kind of data, then only you can easy to perform the CRF annotation. If you know the CRF annotation, then only you can write the SDTM specs. If you know the SDTM specs writing, then only you can write the programming. Okay, so this is all interlinked. So that's why I'm keep on asking that please read the SDTM IIG and come up with the questions if you are not able to understand. Okay, so yeah. That's it for today. Is there any questions? Okay. So I can take it as no. Yeah. Thank you everyone. Bye bye.